The listening part of the occupational English test has 3 parts, and in each part you hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract only once. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check answers. Part A. In this part of the test, you hear 2 different extracts. In each extract, a health professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Hiromichi. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, doctor. Good morning.
Good morning. What's your problem?
Well, doctor, I feel like suffocating whenever I lie flat on my back. I have noticed that whenever I would recline backwards, I get this feeling, and the problem has worsened recently. I'm now sleeping in an upright position.
What's your age?
54, doctor.
You had any surgeries earlier?
No, doctor.
Do you get chest pain?
No, doctor. I get frequent urination and shortness of breath.
Do you have any sort of bleeding disorder?
No, doctor.
Have you suffered or are you suffering with any other diseases?
Yes, I have type 2 diabetes mellitus, hypertension, asthma, and high cholesterol.
May I know if there is any family history of diseases?
Well, my brothers had prostate cancer, and my father had brain cancer. My brothers and sister have diabetes.
Okay, what medications are you taking?
I am taking glipizide, 5 milligrams twice a day, metformin, 500 milligrams twice a day, Atacand, 16 milligrams daily, metoprolol, 25 milligrams twice daily, Lipitor, 10 milligrams daily, pantoprazole, 40 milligrams daily, Flomax, 0.4 milligrams daily, Detrol, 4 milligrams daily, Zyrtec, 10 milligrams daily, Advair Discus, 100 over 50 micrograms, 1 puff twice a day, and fluticasone spray, 50 micrograms, 2 sprays daily.
Are you allergic to any medication?
No, doctor. Extract 2. Questions 13 to 24. You hear a physician talking to a patient called Mackenzie. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, doctor.
Good morning. Have your seat. What's your problem?
Well, I have a 2-year history of small cell lung cancer that has metastasized in both femurs, lower lumbar spine, and pelvis. I had numerous chemotherapy and radiation treatments and just completed a series of 10 radiation treatments for pain relief. But I have persistent pain symptoms, mostly in my low back and on the right side radiating down the back of my right leg to knee. I have some numbness in the bottom of my left foot and some throbbing pain in the left foot at times. The pain worsens with prolonged sitting in a car, walking, or standing.
Well, what is your age?
I'm 45, doctor.
You had any surgery?
Yes, a chest port placement.
What medications are you taking now?
Duragesic patch, 250 micrograms total. Celebrex, 200 milligrams once daily. Iron, 240 milligrams twice daily. Paxil, 20 milligrams daily. Neurotonin, 300 milligrams 3 times daily. And Percocet. I am also having warfarin 1 milligram daily to keep my chest port patent.
Do you drink or smoke?
Yes, I smoke 1 pack a day, and it has been the same habit for about 30 years, and I drink beer approximately twice a day. Don't know when I started that.
Well, the neurological examinations show that reflexes are 2+ in both knees and absent at both ankles. Sensations are decreased distally in the left foot, otherwise intact to pinprick. Examination of your lumbar spine shows normal lumbar lordosis with fairly functional range of movement. There's a significant tenderness at your lower back lumbar facet and sacroiliac joints that seem to reproduce a lot of your low back and right leg complaints. The multiple scan reports reveal that abnormal uptake involving the femurs bilaterally. You have increased uptake in the sacroiliac joint regions bilaterally. MRI of the lower hip joints shows heterogeneous bone marrow signal in both proximal femurs. Pelvis CT shows a trabecular pattern with healed metastases. CT of the orbits reveal a small amount of fluid in the mastoid air cells on the right. You have small cell lung cancer with metastasis at the lower lumbar spine, pelvis, and both femurs. Symptomatic facet and sacroiliac joint syndrome on the right, and chronic pain syndrome. Peripheral neuropathy of your left foot is probably secondary to the chemo and radiation treatments. I will plan on injecting your right sacroiliac and facet joints under fluoroscopy today. If the pain is persistent even after this injection, you can take an extra 50 microgram patch and take a couple of extra Percocet if needed. From now, you stop taking Paxil, and I am planning to start Cymbalta instead.
That is the end for Part A. Now look at Part B. Part B. In